Hello, my name is Peggy Gunter from Aspen. Aspen would like to present a 3-part commercial blended tube feeding video series. This first video is the effective strategies for using blended tube feeding products. The purpose of this video series is to provide information on general effective strategies for commercial blended tube feeding products, the use of commercial blended tube feeding products in the hospitalized patient, and the use of these products in the home patient.
My name is Catherine Bennett, and I'm a registered dietitian at Chalk Children's Hospital, part of Rady Children's Health. Over the next several minutes, we will be defining and reviewing commercial blended tube feeding products. Let's get started. We first must understand what are commercial blended tube feeding products. Commercial blended tube feedings are ready-to-use tube feeding formulas made from real whole foods that are blended to a smooth enough consistency for delivery via a feeding tube. They are also a convenient alternative to home-prepared blenderized tube feeding. Aspen defines commercial blenderized tube feeding as a formula manufactured with food ingredients or pureed foods and may or may not have added vitamins and minerals. Now that we have defined commercial blended tube feedings, let's review some benefits. Commercial blended tube feedings are ready to feed. Minimal to no preparation is needed, and once open can be ready to give as a tube feeding. This makes them a very convenient method of real food tube feeding for on-the-go, travel, and school, as well as a nice alternative for families who do not have the time to make their own. Commercial blended tube feedings may also be an easy introduction to a blended diet for those families not quite ready to make their own. Comprehensive ingredient lists and nutrition values are available for all commercial blended tube feeding products. Lastly, many commercial blended tube feeding products are insurance eligible and can be of minimal to no cost out of pocket for a tube feeding family. Now let's review some of the common characteristics of commercial blended tube feeding products. There are various types of commercial blended tube feeding products on the market with various amounts of whole foods. For example, some contain an animal-based protein source, while others are plant-based, and some even have a hydrolyzed animal or plant-based protein source. Some have different fiber types added in addition to the fibers from whole foods, while others don't. Some are fortified with added vitamins and minerals, while others are not. Furthermore, they all have varying consistencies, hang times, as well as package forms and sizes. It is important for the clinician to learn about each product's characteristics in order to be able to help a family make the decision for what would work best for them. Now let's move on to talk more about commercial blended tube feeding and what categories HCPCS or HCPCS codes are used for insurance claims. HCPCS code B4149 is the primary HCPCS code for both pediatric and adult commercial blended tube feeding products. B4161 is the HCPCS code used for any pediatric commercial blended tube feeding that has hydrolyzed or amino acid-based protein sources, while HCPCS code B4153 is for any adult commercial blended tube feeding that has hydrolyzed or amino acid protein sources. It is important for providers to know what codes are used for which products to ensure consistent and accurate claims processing by Medicare, Medicaid, and other health insurance programs. Lastly, let's review commercial blended tube feeding viscosity. Commercial blended tube feeding products are generally thicker in viscosity than standard enteral formulas without real food ingredients. Although recommendations regarding the ideal consistency cannot be made, one reason why blenderized tube feeding may improve feeding tolerance is due to this thicker viscosity. Providers should base product selection on individual patient needs, and consistency differences should be discussed with patients. For example, IDSI testing shows that consistency varies between products, and thicker products may require additional water to thin to desired consistency or to infuse. Patients should be made aware that gravity feeds of commercial blended tube feeding products is likely not possible, and pump infusion times may need to be extended to ensure full delivery of the prescribed volume. Syringe feeding using the plunger is often an ideal method of feeding commercially blended tube feeding products and can allow for more flexibility in a patient's tube feeding regimen compared to a pump feeding regimen. Overall, reviewing viscosity is a must for providers when talking with their patients about commercial blended tube feeding options to optimize feeding outcomes. Another important piece of information that both providers and families should be aware of is the concept of fluid volume versus weight of commercial blended tube feedings. Food labeling laws require both ounces by weight and grams to be listed on commercial blended tube feeding products. This is not the same as fluid ounces, which specifies volume. Some commercial blended tube feeding products use weight due to the higher density of the blended food than water. Commercial blended tube feeding products are required to have weight on the label in both ounces and grams. For example, the image on this slide shows a pouch with a gram weight of 341 grams and an ounce weight of 12 ounces. Volume in fluid ounces is also sometimes available on the label or can be found in product materials. Pouches of certain commercial blended tube feeding products will yield less fluid volume than weight volume, again due to the higher density of the blended food than water. The nutrition facts labels refers to the amount of nutrition per pouch of specified weight in ounces or grams. Providers and families need to know this to be able to assess the prescribed amount needed and what nutrition that amount will provide.
Hello everyone, my name is April Church, and next I will be talking about safety considerations with commercial blended tube feeding products. Let's first talk about some safety considerations. Commercially blended tube feeding products may alleviate safety concerns of home blends. Hospital and home-prepared enteral nutrition blends may increase potential risk for foodborne illness or nosocomial infections, and blenders are often cited as the primary source of contamination. Commercially prepared products decrease the need for manipulation and handling, thereby reducing the risk for infection. CBTF are also stable in nutrient composition and present with consistent volumes and thickness. Other safety considerations include experienced clinicians, heightened attention to hang time, viscosity, your patient population, hand washing, sanitation, and storage, increased nursing and caregiver workload, and the knowledge of the patient and the caregiver. General safety considerations for commercial blended tube feeding. First, you want to take a look at your patient population. You want to choose stable, hospitalized patients who have demonstrated tolerance to commercial blended tube feeding products. You also want to take a look at, are they hemodynamically stable, any metabolic disorders, endocrine disorders, or electrolyte abnormalities that may require specific macro or micronutrients. And in these cases, you may need to require a disease-specific or hydrolyzed commercial BTF. You also want to take into consideration that there is an increased risk for microbial contamination. You'll make sure to change and sanitize all mechanical devices, administration sets, and feeding supplies equipment per the manufacturer guidelines, as well as your established policies and protocols in your institution. There is also an increased risk for blocked or damaged feeding tubes. Things you may need to consider are the size of the feeding tube, the type of the feeding tube, as well as the viscosity of the feeding. Some of the thicker products may require additional fluid. You want to ensure proper flushing techniques for formula and medications, and enteral devices should be changed per manufacturer recommendations. Ingredients. Commercially blended tube feedings may have functional ingredients or phytonutrients that may have benefits for patients. And although they are small in quantity, clinicians prescribing these formulas should be aware of potential medication interactions. Next, I want to point out hang times for commercially blended tube feedings. Always refer to the individual formula manufacturer guidelines for hang time limits, but in general, in an open system in acute care, it's anywhere from 2 to 12 hours, and in a closed system in acute care, it's 24 to 48 hours. And on this slide, you will see the recommendations for home hang feeding times. Again, they are essentially the same, but always refer to the individual formula's manufacturer guidelines. Storage considerations. Store unopened CBTF according to manufacturer recommendations and refrigerate open CBTF in reclosable containers and discard any unused formula after 24 hours. Feeding supplies should be cleaned and sanitized according to manufacturer guidelines or hospital policy after a single use. Administration sets should be rinsed between uses with safe drinking water, change sets according to institutional policy, and discard sets as recommended by the manufacturer or after 24 hours. Now let's discuss some transitioning tips. The first thing you want to do is a dietitian or clinician assessment. What is the clinical presentation of the patient, and are they stable and suitable for CBTF? And are they currently tolerating their EN formula? The next thing to consider is whether you're transitioning from the fiber formula to a non-fiber formula or vice versa. Here is a bolus transition example. This is a transition from a pediatric peptide-based 1.5 calorie formula to a pediatric plant peptide-based 1.5 cal formula. And as you can see, it takes over the course of 5 weeks where you're interchanging the cartons based on tolerance. And you may go slower or faster depending on how your patient tolerates it. Some people may be able to transition over the course of 5 days per se. And also to note that some of these formulas do come in pouches and are larger volume, so it may take a little bit more time with those regimens as well.
Now it's time to get the feeding ready. The supplies you may need to get ready for your feeding are the formula, a syringe, possibly an administration bag, a towel, and a measuring cup. You want to start with a clean workspace. First, agitate the container of formula, either the carton or the pouch, to make it easier to pour. For a pouch, cut the quarter at an angle so it makes it easier and less messy to pour. If you dip a syringe in the pouch to administer the feeding, use a towel to wipe off the outside of the syringe before connecting it to the enteral access device. As you get the feeding started, remember the hang time of the product that you're using because all formulas have different hang time recommendations. This means that the feeding should not be at room temperature greater than the time recommended, including the time to prepare it. Another useful tip is that feedings are best tolerated at room temperature. If you are using a home blend from the freezer, thaw it safely, and then you may need to reblend it to decrease the particle size. For a commercial blenderized feeding, agitate the container well before opening. And it's safe to warm the feedings in a bowl of warm water or run it under warm water to warm it. Microwaving is not recommended. Depending on the administration method, adding fluid may or may not be needed. This varies depending on the administration modality and the formula used. In general, the thickest formulas are best administered with a syringe. However, consider the addition of fluids for thicker products if you're going to use them on a pump with a gravity bag or a direct access device by adding warm fluid to help thin the formula. But be aware this does change the caloric density. You may want to consider using a nutrient-rich fluid to thin the blend. It's also important to remember if additional fluid is needed based on the clinical situation, this can be added to the formula or given between feedings based on the schedule and tolerance. You have heard me mention direct access devices. This is what they look like. Option 1 is for a gravity flow that can allow the product to flow directly into the enteral access device. There's also an option for manual manipulation of the pouch, similar to using a tube of toothpaste to administer the feeding. All of these products work well on commercial blenderized formulas.
Now let's transition a little bit and talk more about the blenderized tube feeding administration methods, dive a little deeper into the things that we have to keep in mind. I want to begin with some things that we learned in home care when we were able to study a population of patients who were using commercially prepared blends. When we looked at the patient population and specifically the age group, the demographics that were receiving those commercially prepared blends, we noticed that over half were pediatric and under the age of 18, and over half of those were under the age of 5. So that told us a little bit about the population that was driving the utilization of the commercial blends in the home setting. And then we dug a little deeper and looked at what method of administration were they using? And despite many of the manufacturer recommendations to lead with bolus feeding, we noticed that the majority of our patients we're actually using pumps to infuse their commercial blends. So keeping that in mind, we needed to move forward a little bit more intentionally with understanding about how the pumps were functioning with these thicker blends running through them. Accurate nutrition delivery is key to good patient outcomes. Not all pumps are designed to infuse thicker blends, and blenderized formulas are harder to pump due to their thicker consistency, and that high viscosity can reduce the amount delivered compared to what the pump says it actually infused. Research shows that about 22% less volume is delivered than what's actually programmed, and that can impact nutrition, it can impact weight trends, weight gain, and best practices are needed in order to ensure accurate delivery. First, use volume-based goals like containers per day or pouches per day instead of relying on the total volume that the pump is reporting. That may not actually reflect what was actually delivered. If the formula is too thick, consider thinning it with a calorie-containing liquid to maintain good nutrition value, not diluting the nutrition that's being delivered with water while still improving flow. It's also important to manually flush the tube with water before and after each pump infusion, and that helps prevent clogs. It ensures that all the formula that is in the line of the tubing also gets delivered. And finally, be sure to work closely with a nutrition support professional, and that way you can tailor the approach to each patient's needs to ensure safe, effective feeding. The enteral feeding pump space is evolving, and there's innovation now with pump settings and feeding sets that are calibrated to accommodate the thicker blenderized tube feeding formulas. What that does is it improves the accuracy of what the pump is telling you was infused, actually reflects what was delivered to the patient. Enteral innovation isn't limited to feeding pumps. You can rethink what bolus feeding looks like. It doesn't have to look like a syringe. We do have products now that allow a patient to directly connect to a carton of formula or to pouches of store-bought pureed food, blenderized tube feeding that come in connectable pouches, or reusable pouches where you can put homemade blends or commercial formula and reuse those bags and use them as a squeeze pouch. It's a little bit easier for some patients to use these methods as an alternative to syringe feeding. When a syringe is chosen as the method of administration, there is some nuance and some decisions that can really impact the patient experience. So knowing the differences between these two syringes could be helpful for your patient. On top is a standard stopper style syringe, and below that is an O-ring syringe. And one of the things you'll notice is the difference in diameter of the gasket on the plunger. And when that plunger is pushed through the barrel of the syringe, that O-ring syringe offers less resistance. It makes it a much easier experience, especially when you're using a thicker blend, administering that as a bolus feeding. We have options with gravity bag feedings as well, and this information can help you make a difference in your patient's experience with gravity flow. We have small bore gravity bags and large bore gravity bags, and you can see the difference between the two. You can handle more volume, thicker formula through the large bore bags. Although many patients have a hard time allowing formula to flow freely with some blends, it just depends on the viscosity and thickness of that formula as to whether or not gravity bag feeding is the best method of administration for them. Here we take a little bit closer look at the alternatives to both syringe and gravity bag feeding with the innovation I introduced to you just a minute or two ago. This is the reusable squeeze pouch. Again, it allows thicker formula to be squeezed through, or you can hang it as a gravity bag as well when you have a little bit of a thinner blend as an option. The direct connect option again allows pureed food or blenderized tube feeding pouches that can connect directly to the patient's feeding tube. And again, it's an alternative to bolus feeding. They're reusable, they're portable, and available through many of your home care DME companies. One last consideration for your patients with low profile devices or buttons. they'll be using extension sets in order to connect to their feeding tube to administer their formula. Straight or bolus-style extension sets are larger in diameter and stick straight into the valve of the button. When you look at the right angle extension set, you'll notice there's a right angle turn that the formula would have to flow through, and the tubing is generally smaller in diameter, and that could restrict the flow and speed of formulas that are a little bit thicker. So keep that in mind when you're assisting your patients with buttons, make selections and choices to improve their experience with administering commercial blends through their feeding tube.
Here are the references for this video. And here are some additional references. This educational offering was provided to you by Aspen. It was co-sponsored by Functional Formularies and Real Food Blends. Real Food Blends is part of the Nutrition North America family of brands.